Hi, and welcome to the podcast, Use Your Powers for Good. I'm your host, Carolyn Opa-Moselle, and I am so glad that you're here. This is a podcast to inspire leaders, managers, and supervisors to use your powers for good to put more kindness into the world. Today's guest is Peter Waziri. Peter is the Chief Financial Officer for Parkland Community Health Plan located in Dallas, Texas. Peter provides financial leadership for the organization's operational and clinical management functions, including network strategy, hospital, physician, and ancillary contracting, network managing, risk contract reporting, medical cost containment, and growth. He also works with providers to find innovative ways to address the social determinants of health and foster greater coordination of care within the overall provider network. Peter brings 25 years of progressive leadership experience in finance from both the healthcare and financial services industries. And Peter is on a mission to make a difference in the lives of others. Peter is going to talk to us today about how he uses his leadership to make that difference. Welcome, Peter. We are so glad that you're here.
Thank you. I'm glad to be here.
So I gave a lot of your background, but can you tell us about a little bit about what led you to do the work that you're doing today?
So I've always, again, you have a fascinating topic for this podcast, using your powers for good. I've always been a numbers guy all throughout my professional career, and I've always been looking for that avenue to see it's not just about a spreadsheet, it's not just about building models, it's not just about balance sheet and income statement. How does that affect the world? In fact, after my undergrad was in international banking and finance. So I consulted with a think tank in the UK, and we did a lot of United Nations projects, like International Year of Shelter for the Homeless. Like we're looking at financial systems in developing countries and seeing how can you build out a financial system that can help economic development, that can help job growth. Because you can have the engineers and all the other technology in the world, but if you don't have the financial resources collectively harnessed, it's tough to fund projects. So that can lead to a multiplier effect that will lead to economic growth, and then people are better off in developing countries. So that has been the basis of what's been driving me since then. And in financial services here in the US, having done all the gambits of going through corporate banking, investment banking, financial advisory, and investment management, I could always point to say, I helped this company either raise the first funding for them to build their first restaurant, or to build their first chemical factory, or to build their first warehouse. And then I went from hiring 2 people to hiring 200 people, right? Wow. That to me, that's an intangible piece. Yeah. Same thing. I helped this company build either a mall where people can come and shop and kids can come and play, or is it a high-rise building in the downtown district where over 1,000 employees now work there for various companies? I can relate that to people. And I wanted to make sure that I had that same passion, that same satisfaction when I got into healthcare as a chief financial officer for a health plan. Now I can point to say, I helped this couple or this family receive and qualify for Medicaid, right? So now they can have coverage for the children and the family and the kids. And they can get preventative care, which prevents chronic care down the road. I can also say, I helped this couple, retired couple, get Medicare, because Medicare is very complex, even for the most sophisticated and educated of us. Trying to even understand it, sitting down with the health insurance broker, it makes a lot of people, makes their heads spin. And then also, even in commercial, right? Looking at ACA, like, do we help people, obtain healthcare through the marketplace? Do we help companies like get healthcare coverage for their small band of employees, because they're not the huge national companies that can get good rates. So when you look at that, as you know, in the US, US, for my opinion, has the best health system in the world, but only if you can afford it. If you can afford it or you don't have coverage, it's not good. Other countries'
That is
healthcare
true.
systems are better for you in that regard. So, so that I have a passion for making sure that everybody gets coverage, and so that's how I relate what I do to helping people.
Well, you really made me think about how leaders really need to be in touch with their why. And that you have really demonstrated that your why is just, it's simple but complex in the depending on what your vehicle you are using to deliver it, but you really just want to have an impact on a good impact, a positive impact on the lives of other people in the work that you do. And when people think of chief financial officer, we think of spreadsheets and budgets but looking at it through the lens that you've described was really I think eye-opening, and something that leaders listening to this podcast should really really consider, identifying and being clear about what their why is, no matter what their work is. Like you said, like you do a lot of work around budgeting and keeping systems
Yeah, well
going
said.
and all of that. But if you did not do that, then people would not be able to get the services that are being provided by your organization. So that's
Well said.
some great insight. We appreciate that.
Mhm.
So you know what I didn't ask you was to tell us a little bit about what Parkland does.
So Parkland as a health system is a safety net hospital system for the citizens and residents of Dallas County.
Mhm.
So, and it's also partly funded by Dallas County tax payments. And even the board of directors are elected by Dallas County commissioners. And so we happen to be the health plan side affiliate of that system. So you have the hospital side, you got the data analytics side, you got the foundation, and we're the health plan. So Dallas Parkland as a system serves all the indigents of Parkland. So if you get shot, emergency service, Parkland is number one. It's got a level 1 trauma center. It's got an excellent burn unit, and it's well renowned nationally and internationally. And that kind of service, and it's well funded, and that kind of system is available to the citizens of Dallas County. We were one of the first institutions in the country to get shipments of COVID vaccine when it came out,
Hmm.
when other hospitals didn't even have it.
Right.
So that's how that's how much Parkland health system is held in high regard. So it serves Dallas County. Majority of the patients that walk through the door, or so a substantial part of the patients that work for care, don't have health insurance, and they're not turned away.
Okay.
So and they get first world class, care. Either if it's just some emergency visit to wound care to delivering babies, maternity and prenatal care. I think Parkland delivers more babies than most of the large systems in this country. People don't know that. So
Wow.
again, excellent maternity care. So it's a system that is on a mission, and that is congruent with this with the health plan, because the health plan here we're primarily, for at least for now, we're a Medicaid shop. So we help make sure that the Parkland and not just the Dallas County residents, but the other 7 counties that we serve that are joined the Dallas County
Mhm.
have access to Medicaid treatments, right? So that's what we provide, and what we do as a health plan is very much in line with what the goals and aspirations of the system.
Awesome. Okay. I thought that was important to know as we are having, we continue our conversation.
Mhm.
And then, people can link up your why and your passion for what you do with the services that you are helping to deliver to people. So that's a great connection. Now, I know you mentioned earlier about how you also love that you were able to see your impact, hire 2 people to 200 people. So tell me a little bit about how you convey your passion and to serve to the people that you are leading, because you touch a lot of systems, especially in Parkland. So there are a lot of people to get on the same page, so to speak.
So within the organization as a whole, Parkland Community Health Plan and the Parkland system as a whole, we all have to work collaboratively for the common goal that we have. So I try to educate, right? And I try to actually, let me back up. The first thing I do is listen. That's the first thing I do, listen.
That's
I
imperative.
remember when I joined Parkland, yes, I just, when I first joined the system, I just wanted to meet as many of the leaders that I felt I was going to touch sooner or later. And I remember I just, and this was before COVID, so we're all in the offices. And I sat down and I said, I prefer to come and see you in your office, sit down and introduce myself and take out my notepad, and that's it. I don't say anything. The next thing I typically say is, thank you for your time. I really enjoyed meeting you. But I just ask the questions. What are your pain points? First of all, what do you do? What are your pain points? And how can I now or in the future, in any way possible, make a job just a little bit easier if I can? And so I listen. And then
Mhm.
with my own team, I try to hire people. Number one, I always say I try. They have to. They're smarter than me. I don't. I like to
I
make
agree with
myself
that.
the weakest. Yes. So it's good to have smart people working for you because they have better ideas than you. And if you lead and motivate them properly, they would exceed your expectations because knowing the end result. Then the third piece is now also trying to educate them how they can how they can relate their job to helping the population we serve, to helping the members that we serve. So as we're trying to look at standing up an ACA marketplace product, for example, how do we work collaboratively with the hospital side of the system
Mhm.
so we can both look at the same unique set of data and come up with projections about that, and then recognize what are the barriers, right? What will make, how can we get these people, if they don't qualify for Medicaid, how can we get them ACA coverage in the marketplace?
Mhm.
And can they be subsidized? Can they, can they not be subsidized? How much is it going to cost? We're going to have all that, flush out all that discussion. How can we keep them on coverage, right? Because some
Mhm.
of these individuals are not, they've not been trained as to how to obtain something and pay for it repeatedly and
Mhm.
realize the value. So then the next thing is, how do we have educational classes, right? And can any one of my team like present just a simple financial tool or a financial presentation, one of those educational classes,
Mhm.
right? Then how do we fund, right? You see, as I'm peeling all these layers, now you're seeing how this
Mhm.
works. How do we fund and make sure we have a vendor that looks at disease management as a whole well into the future? It's a long-term plan. If you're sick, you come to the hospital, yeah, we treat you. If we see you have a comorbidity, maybe you're diabetic or maybe you have asthma, yes, we treat you for that.
Mhm.
But what causes the diabetes, what causes the asthma? So how can we train, right? And make sure that people, do you have lead? We did a study, we
Right.
discovered that some of our members where they stay is in an unhealthy environment. Okay, can we sit down and work with the city
Mhm.
and the
Mhm.
county in terms of, we now start going to social determinants of health? And if we do that, how do you track your results? How do you get the data to
Mhm.
track your result? We always relate it back to finance. So there is a lot to do, and it's very challenging, and it's extremely complex. And I tell myself I only form less than 1% of all this chain of people that we need to touch
Mm.
and work with in order to do good by our members. And the fun part is getting all these relationships and walking through it and getting to the end and having these small wins.
Yeah.
And keep having small wins. You can never have a big win with this. It's almost important to small wins, small wins, small wins.
Right.
And before you know it, you discover that you have an impact, but it wasn't easy to get to.
That's
So it requires
really,
teamwork.
yeah, I love that. I love all of that, by the way. And I was taking a couple of notes. I loved when you, and I think this is important piece for leaders who are listening, especially when you're entering into a new job or a new space with people that you have not led before, or even people that you know may turn in. Some people turn into, like I did, from being a colleague to their supervisor.
Mhm.
So that's a different set of listening skills that you need to have. So I love when you said that you go in and you listen and you ask them about what they do, the pain points that they have, and how you can make their job easier. And I think those are three great listening tips that any leader can take with them, no matter what profession they're in, because those are three things people want to know. How can their job be made to feel easier, better, more impactful? And as a leader going into a new space with new people, I think that it's imperative that you listen to that and understand that, and that leads to how you talked about the direct hires that you make. And number one, hiring people smarter than you. Yes. I'm always a believer in that we all have such unique skills to bring to the table. So if everyone thought like you or me, when you would get the same result. So there's not a lot of innovation in that. But I loved
Mhm.
how you lead and motivate your people so that they can understand their impact as well. So that is, you kind of answered a lot of my questions in that one. But the one you didn't answer, I'll say this: how do you keep yourself motivated?
um, I think it's I hate to say that I don't need to keep myself motivated because this is what wakes me up in the morning.
Ah,
But um, but then that is also how I keep myself motivated. It's not the technical skills. It's not the fact that I love learning new things, either a new product or a new industry. In financial services, I found there's so many industries, so I just love learning about what makes different industries tick and the characteristics. Learn about what's happening out there. I brought my background from the global macroeconomic policy. How do governments set policy? How do they affect economic growth? When I look at this, the ability to impact people on a very, very positive level and a large scale. If you've gotten that buzz and you've done it across countries, it's a drug that doesn't leave you,
yeah.
right? It doesn't leave you, especially if it's something that you love doing. And it's even much more fun because now the fun part comes in. If you can now um, take the same skill set and transfer them, like in a county, in Dallas County,
Hmm.
and we do it in Collin County, right, next door. Can we do it with the new products that we're bringing up? When you look at that, it's like no matter what hill I climb, the next hill is always bigger, or the
Hmm.
next hill is always different. And not nobody can stand still. We all need some kind of passion, right? And this is one of the passions I have because it motivates me to even to think differently. it challenges me when I go through something I haven't been to before, and I'm sweating bullets, trying to get this done. But in the end, when I look back, I'm always glad that I went through it,
Yeah.
good or bad, because I learned something from it, something for this insatiable desire that I have knowledge. So maybe in a way, it's like it's an insatiable desire for knowledge and the achievements that I've been talking about. That's what motivates me.
Mm-hmm. Mm-hmm. That is really, really very insightful, because I loved when you say, this is what I got from it, the passion for your work wake you up in the morning. That's what I think I heard you say.
Mhm.
Your passion for your work wakes you up in the morning. And that is that is so important, especially when you are leading people, because people feed off the energy that you are bringing to your work. So if you're not if you're not feeling passionate about your work, then it's hard to convey other people to be passionate about the work. So I love that. I love that so much. So tell me, Peter, what lessons have you learned along the way that have come from leading people?
One quick lesson is that you're not the sharpest, nobody's the sharpest tool in the shed. Young guy always like to think like, I want to be the sharpest tool in the shed, but you learn very quickly. The sharpest tool in the shed. That's the first big lesson. The second big lesson is every individual is different, and every individual has a strong desire to be themselves at their jobs, and you have to manage and work with people differently and lead differently. The people that they need, they understand and move forward by discussion, and that discussion is a verbal discussion. They like to discuss things with you. Some people just like an email, right? Some people, they just want you to listen. And after you listen, then it's like, then they feel that, okay, once it's listened, my boss has listened, then I'm going to do this, right? Maybe it's a way of them seeking approval.
Mhm.
But everybody has a different, unique style, right? And what I've learned is the more flexible I can be, the better leader I can be. And as I'm being that flexible, the more attention I pay to the price. What is the goal? Where do you want to get to? What is the plan? What do you want to achieve? The more I intense my focus on that, it helps me guide me in terms of the flexibility, which means
Mhm.
you always bring everything comes back to the center at the end. You can go to the side and off the roads, but everything always comes back to the center, right? Keep your
Good
eye on the
point.
prize.
Mhm.
But it's having to lead people and just learn about people, the people you meet, the people you work with. Yeah, so that's it's a lot.
Oh, no, I love that, because the work that I do is rooted in behavioral and emotional intelligence skills, developing those skills. And so
Mhm.
part of that is number one, learning to read the room, learning to read people, and learning how to do it in a way where you can support them to be, the best version of themselves in their work that they're doing. So I think we're like cousins or something. It's yeah, we're leadership cousins, leadership
I
philosophy
like that
cousins.
word, leadership cousins. Yes. Mhm.
So no, I love that. I love that. So tell me, if you could sum it up into maybe two or three of your best leadership tips for people listening, what would they be?
Attentive listening,
Mhm,
intensive coaching,
mhm.
and and directional leadership.
Okay, I like
So you got
that's.
to listen,
Mhm.
Yeah, you gotta listen to your team, and because if you don't listen, you will miss the little nuances where it might be a little twitch or fix, but it makes an outsized influence, right?
Mhm,
And to them
mhm,
it might be huge, but to you it's just a little teach, right? Small step for me, giant step for somebody else, that
right.
kind of thing.
Yes.
And then coaching, yeah, and the coaching too is not you're not teaching somebody how to do something. That's why I love working with people who are smarter than me,
Mhm.
because that's where coaching becomes a pleasure,
Yes.
because they get what I'm saying before I say it. I'm halfway done, they complete my sentence, and
Right.
then they come back and even add to it, right? And if it's something they haven't done before, it's a pleasure to coach that kind of individual, because you can see them absorb it like a sponge.
Mhm.
And then which the third thing is the directional leadership. What's the goal? What's the price? Right? What's the goal? What's the price? Keep focus on that goal and price. And so to me, it's like, yeah, helping people,
Mhm.
working hard, you know, make sure we are a cohesive team, and make sure we have a set our goals, either annual goals or quarterly goals or department goals or company goals. Make sure we have that set. And also the goal is to have fun
Mhm.
with all this stuff. You're serious with the work, but you have fun afterwards. And you have fun so that way everybody, remains human.
Yes. That's very important because we are all humans. So sometimes
Hmm.
we tend to forget that when we're at work, but
Hmm.
that is, that's not going to change. So those are some great tips. So
Hmm.
Peter, my final question is tell us how you put more kindness into the world.
Uh, with a smile, individually, smile,
Hmm. Okay.
smile. Um, it's no matter how bad it gets, no matter how frustrated I am, try not to shout. I think just smile.
Hmm.
Uh, but have the backbone never to back down for anything that you're
Hmm.
convinced about, no matter how much anybody pushes you.
Hmm.
Uh, and then make sure people can always say, I like his smile. Oh yeah, how come that guy never got mad? That makes the world a better place.
Hmm. I agree. I agree. All right. So, Peter, for those who are in the Dallas area, tell them how they can connect with Parkland to get more information about the services that you guys provide.
So yeah, they can reach out to our website. Our website has all the information about Parkland PCHP, and they can reach out to the website of Parkland system as a whole, right, and look at how we're serving the residences of Dallas County. And they can always reach out to any one of our media facing departments to get more information. And we have brochures, and we have information that we put out to the public on a regular basis. So if they start from any one of those angles, yeah,
Mhm.
they will learn more about us.
All
Mhm.
right. So, really quickly, provide the website address.
Okay, so that's parklandhealth.org.
Parklandhealth.org. Okay.
Yeah.
All
Mhm.
right. So, for any of you who are listening or know folks who live in the Dallas area, you said Dallas and the surrounding
Dallas
county,
County, yes.
Dallas
And then,
County.
yeah, that's one county. There's six more counties,
Ah,
that are very, in which we serve. Mhm.
okay. All right. So if you know anyone in that area, or if you live in that area yourself, reach out and take a look at the parklandhealth.org website and see if you can utilize their services. So, Peter, thank you so much for being here today. It was a pleasure to get your such great insight on leadership and passion for doing your work. We appreciate having you here, and And for those who are able to join us today, thank you so much for being here as well. And until next time, be better today than yesterday. Be better tomorrow than today. Bye for now.